Important things to keep in mind during early pregnancy. A guide for expecting mothers in the first trimester pregnancy is a miraculous and sacred journey for women. The first trimester, the first 3 months of pregnancy, is considered one of the most crucial and sensitive periods. During this time, the baby begins to develop vital organs such as the brain, heart, lungs, limbs, and nervous system. The mother's body also starts to undergo significant hormonal changes, leading to various physical and emotional symptoms. Therefore, understanding what to watch for during early pregnancy is essential to safeguard both the mother's health and the baby's development. Below is a comprehensive guide to help expecting mothers take better care of themselves and their growing baby during this critical period. 1. Confirming the pregnancy and scheduling a prenatal checkup once you notice a missed period and experience symptoms like nausea, fatigue, or tender breasts. You should take a home pregnancy test. If the result is positive, it's important to schedule an early prenatal appointment with a reputable healthcare provider to your first visit. The doctor will accurately determine the gestational age. Check if the pregnancy is intrauterine to rule out ectopic pregnancy. Conduct an initial ultrasound to detect the fetal heartbeat. Provide advice on nutrition, lifestyle, and prenatal care. Recommend essential tests such as blood type, HIV, hepatitis B, rubella, and more. Early prenatal care helps detect potential risks and gives peace of mind throughout the pregnancy. Point 2. Taking folic acid and other essential nutrients in the first trimester. Folic acid, vitamin B9, is one of the most important nutrients. It helps prevent neural tube defects in the developing baby, such as spina bifida. WHO recommendations. Women should take 400 to 800 micrograms of folic acid daily, starting at least 1 month before conception and continuing through the first trimester. Other essential nutrients include iron, prevents anemia and supports fetal development. Calcium, aids in forming strong bones and teeth. Vitamin D, enhances calcium absorption. Iodine, crucial for brain development. Only take supplements under medical supervision and avoid self-prescribing or overdosing. Point 3. A balanced and safe diet. Pregnancy doesn't mean you need to eat for two, but it's important to maintain a well-balanced, nutrient-rich diet and avoid unnecessary dietary restrictions. During the first trimester, you might experience morning sickness or food aversions, so try eating light, easy-to-digest meals. Recommended foods. Foods rich in folic acid: spinach, broccoli, oranges, avocados. Foods high in iron: red meat, liver, eggs, tofu, whole grains. Foods rich in calcium: milk, yogurt, cheese, small fish with bones. Plenty of fruits and vegetables for vitamins and fiber. Proteins from lean meats, fish, beans, and eggs. Foods to avoid: raw or undercooked foods, e.g., sushi, soft-boiled eggs, rare meats. Risk of infection: caffeine, strong tea, and sugary sodas should be limited. Alcohol and tobacco increase risk of birth defects. Fish high in mercury, such as swordfish and large tuna. Eat small, frequent meals throughout the day. Stay hydrated with 1.5 to 2 liters of water daily, and consider natural fruit juices. Point 4. Rest and emotional well-being. Hormonal changes during pregnancy can cause fatigue, irritability, nausea, or insomnia. Therefore, it's essential to get enough sleep, 7 to 9 hours at night, and a 30-minute nap during the day if needed. Create a calm, comfortable sleeping environment and avoid screen time before bed. Manage stress through relaxation techniques like deep breathing, meditation, gentle pregnancy yoga, or walking. Family members should offer emotional support, understanding, and encouragement during this sensitive period. 5. Avoid self-medicating. The first trimester is when the fetus is most vulnerable to external influences, including medication. Certain drugs can increase the risk of miscarriage or birth defects. If you have a cold, fever, or allergies, always consult your doctor before taking any medications. Avoid herbal remedies or traditional medicines without medical advice. Also, be cautious with skincare products, hair dyes, insect repellents, and household cleaners. Choose pregnancy-safe options and limit exposure to harsh chemicals. Point 6. Avoid strenuous activity and unsafe postures while complete bed rest is not usually necessary. In the first trimester, it's important to avoid heavy lifting, jumping, excessive stair climbing, or activities that pose a fall risk. If you've had previous miscarriages, a history of complications, or a high-risk pregnancy, e.g., through IVF, your doctor may recommend more rest. Safe physical activities include gentle daily walks, prenatal yoga with a trained instructor. Avoid standing or sitting in the same position for too long. Always listen to your body and stop if you feel dizzy, out of breath, or experience discomfort. Point 7. Watch for warning signs and seek medical attention promptly. Not all pregnancy symptoms are harmless. Some may indicate serious issues and require immediate medical attention. Vaginal bleeding, even in small amounts, severe abdominal pain or cramping, excessive nausea and vomiting causing dehydration or weight loss, high fever, which may signal an infection, burning sensation during urination, which could be a urinary tract infection, dizziness, fainting, or intense headaches. Never ignore unusual symptoms. Early intervention can prevent complications. Point 8. Vaccinations and prenatal testing. Certain vaccinations are essential to protect both mother and baby, especially during the first trimester. Flu vaccine helps prevent seasonal influenza. Tetanus vaccine, TDAP first dose recommended from the second trimester. Hepatitis B and rubella, ideally given before pregnancy if immunity is lacking. Essential prenatal tests, blood tests for anemia, blood group, tests for infectious diseases, HIV, hepatitis B, syphilis, immunity check for rubella, and toxoplasmosis. Prenatal screening for genetic disorders, double test, NIPT, non-invasive prenatal testing, etc. Your doctor will provide a personalized testing and follow-up schedule. Point 9. Maintain a safe and healthy environment. Expecting mothers should live in a clean, well-ventilated, and low-stress environment and minimize exposure to secondhand smoke. Even passive exposure is harmful. That pesticides, cleaning products, paint fumes, and other toxic substances. Unregulated cosmetics or beauty treatments. That if you're working, inform your employer about your pregnancy early to adjust your workload and avoid physically or mentally strenuous tasks. Point 10. Mentally preparing for motherhood. The first trimester is not only a time for physical changes, but also for mental and emotional preparation for motherhood. Take time to learn more about pregnancy through books, prenatal classes, or online support groups. Share your feelings, whether joy, excitement, or anxiety, with your partner or family. This strengthens your emotional connection and builds a supportive environment. That a positive mindset is incredibly beneficial for both mother and baby, influencing the baby's emotional and cognitive development. The first trimester is a vital foundation for your baby's growth and overall pregnancy health. Being informed about what to expect and what to avoid during early pregnancy helps expecting mothers feel more confident and prepared. Listen to your body, monitor warning signs, follow medical guidance, and most importantly, take care of your emotional well-being. Wishing you a healthy and joyful pregnancy journey.